Tonight at 6 o'clock, a lapsed lockdown tradition revived. The Prime Minister asked people to come onto their doorsteps and clap for Captain Tom and for the NHS. It happens as the government tries to preserve the benefits of the vaccine rollout against mutations of the virus that threaten to undermine progress. So, in Maidstone, Kent and 7 other selected sites across England where the South African variant has been spotted, volunteers and emergency services joined forces to distribute testing kits door to door.
Thank you so much for your cooperation.
Day one was fantastic. We've had sort of over 95% of people quite willing and eager to have the test done. I think there's no two ways about it. This is probably the worst crisis that's hit these communities in several generations, and people want to do what they can to fight the virus.
It's a good thing that it's going on. We've had a case in the area. Admittedly, we don't know where it is, but it then means it's keeping people safe, and a better way of tracking it, if it helps everyone across the country, then it's worth doing.
Of the thousands of mutations of the virus that have developed around the world, 4 are causing particular concern here right now. The Kent variant has spread nationwide, responsible, it's thought, for 70% of current infections. It's thought to be more transmissible than the original COVID-19. The South African variant, which has come into the country, is a cause of concern because our vaccines are less effective against it. The 2 new mutations, now spotted in significant numbers, one in Bristol and one in Liverpool, are homegrown, but like the South African variant, they have more chance of evading vaccine protection. Oxford AstraZeneca said it was planning a second-generation vaccine ready for the autumn to protect against some of the newest strains of the virus that might be circulating next winter. At the Downing Street press conference, the chief medical officer said the current wave did appear to have passed its peak. The Prime Minister said lifting lockdown when it happens may well not be done on a regional basis.
There are some variations and some things are going in slightly different directions in some parts of the country, but it's pretty uniform at the moment, and therefore it feels to us at the moment as though we'll be going down in tiers nationally, and I think but that obviously could change.
Chris Whitty was asked about abuse he suffered on the street from a youth who posted the confrontation online.
You're a liar. You're a liar.
I was very surprised it was picked up by the media at all as anything of any importance. I'm sure he'll become a model citizen in due course, and hopefully more like Captain Tom, who's the kind of person who I think much more exemplifies the spirit of the UK.
Not long after, the clapping for Captain Tom and the NHS began. A Prime Minister often accused of being too much swept along by the good news, today hailed the 10 million vaccination figure, but refused to offer any hope of speeding up existing lockdown relaxation plans, and warned that infection rates were still alarmingly high.
Let's talk now to Dr. Mike Tilsley, an epidemiologist who's a member of SPI-M, the committee which provides infectious disease modelling evidence to SAGE. He also advises the government on the transmission of COVID-19 in schools. If these vaccines are less effective on these new mutations, how does that change your calculations for things like when to reopen schools?
Well, of course, I mean, this is a concern. The problem is if the vaccines are less effective, then, of course, what this means is this delays things. One of the big concerns at the moment with the vaccines is, well, firstly, are they effective in terms of developing symptoms? But secondly, do they prevent individuals who are vaccinated transmitting the virus to other people? Prior to the emergence of the South African variants and these new variants, we did know that we had a very high level of protection from developing symptoms, and we're starting to get good evidence that suggests there's some level of blocking of the ability to pass on infection. What's more concerning with these new variants is it looks like it slightly lessens the sort of ability of the vaccines to provide protection. So it does mean we're going to be a little bit longer, sadly, in terms of getting back to normal, but time will tell over the coming weeks, really, how effective these vaccines are over the current variants that are in circulation. What's
perplexing a lot of people is that we were told by, I think, virtually all the vaccine makers that whatever their efficacy rates of between 70 and 90%, they didn't have any cases of severe disease or death after being vaccinated. So if you've removed the risk of being hospitalised or dying, why do we need to worry so much about infection rates?
Well, I mean, what we need to remember, of course, is that, you know, we are getting very, very, when we get high levels of immunity, and that, of course, protects the population from those people that have been vaccinated. And we should see the hospitalizations and the number of deaths start to come down over the coming weeks as we get more and more people vaccinated. Where we're more concerned, of course, is because these vaccines are not 100% protective and we still have an awful lot of the population that have not been vaccinated. As you start to relax control measures, anything that you gain from vaccinating, you could potentially offset, unfortunately, because people are mixing more, which is why we need to be really careful. And when it comes to easing out of control measures, it needs to be done very, very gradually so that we don't lose from increased community mixing what we gain from more and more people being vaccinated.
So, as a member of SPI-M, what's your estimate on when we can start to reopen the schools back to normal and whether we'll be able to travel and go on holiday this summer?
Okay, so these are two very, very different questions, Krishna. And the first one with schools, it's clearly important that we do what we can to get schools back as quickly as possible. Hopefully, in the first instance, I think we clearly need to look at primary. A lot of the evidence around primary schools suggests that they were much less risky, certainly before Christmas, than secondary schools. And we know it's very hard for primary school children to engage in virtual learning. Hopefully, by mid-March, we're in a position that we can get primary school children back. I suspect what we really need to do, because we need to do this gradually, is then have a little bit of a delay before we then get secondary school children back into school. In terms of the summer holiday question, I think that's much more complicated because even with high levels of vaccination, it's going to be very difficult to consider overseas holidays when the virus is still circulating in many other countries around the world. Hopefully, domestic holiday season could be more back on the table with our current trajectory of vaccination, but I suspect it's going to be much longer before we're going to be in a position to have our sort of holidays in the sun, as it were.
Can I just briefly ask you about a study that's come out from East Anglia, suggesting that in the 8 days after people have their first jab, infection rates are going up, which suggests that people are behaving as if they are immune. Is that something that you've seen elsewhere? And how worrying is that?
Well, I think this is if this is true, and I'm not aware of this study, but if this is true, then this, of course, is a concern. And we've always said that actually behaviour is a big unknown in this pandemic. That we know, we look at the lockdown back in March, April, and people were adhering to the rules extremely well. Almost 12 months later, the adherence levels are perhaps a little bit lower. And we've tried to put out very, very clear messages with vaccination. Just because you've been vaccinated does not mean that you are necessarily 100% safe. And of course, by mixing, you're potentially exposing other people. So it's a real concern. A vaccination is not an excuse to mix with everyone. We need to wait until we have very, very high levels of vaccination before we can start to get back to normal.
Mike Tilsley, thank you very much.
Thank you.
Now, just days after the European Commission was criticised for threatening to override the Northern Ireland Protocol in the row over vaccine supplies, Boris Johnson has said he's prepared to do the same thing. The Prime Minister said he could take the action to ensure that there is no border in the Irish Sea. A Democratic Unionist MP said trade problems between Britain and Northern Ireland since Brexit were making his constituents feel like foreigners in their own country. Gary Gibbon is in Westminster for us. Gary.
Well, it's fair to say there's excruciating embarrassment in Brussels about what happened last Friday when the EU effectively put forward the idea of some sort of border control north-south on the island of Ireland, something which the European Union has always said and believes it is 100% opposed to. But what they're saying there now is that they feel that the government here has kind of opportunistically seized on that to start talking about a different border, or rather the effective border that some people feel has been thrown up between Britain and Northern Ireland, which requires checks for some goods going into Northern Ireland. And Michael Gove has written, he's just had a conversation as well with the man who seemed to take full responsibility probably for British-EU relations over there, but currently is dealing with the aftermath of the Free Trade Agreement. He's written to him and talked to him, saying that all the controls that happen there, some of them are already in place, but they're due to get more stringent and widespread soon. All of that should be paused for 2 years. Now, in Brussels, they feel that's a rewriting of the agreement that was only recently signed up to. But they also feel, I think, and you get some echoes of this in Northern Ireland and in the Republic of Ireland, that the government here is potentially playing with dangerous material. Because until recently, if you talk to some DUP figures and members of the government, they told you those controls going east-west, teething troubles, not much to see here. They'll decline over time, they'll become less important over time, and Northern Ireland has the best of both worlds in the deal that Boris Johnson has given them. If you go around, the argument runs, telling, for instance, the loyalists in Northern Ireland that actually this is an agreement that affronts them, that should offend them, well, you might be feeding a very dangerous beast. And it's not entirely clear that Michael Gove's going to be able to deliver on the things, the 2-year pause on extra new checks and more stringent regulations, which he is demanding in this letter, and I suspect in the Zoom call that finished just recently.